Not getting your health and wellness questions answered at your doctor's office? Are you ready to take control of your health and well-being? Do you want the proper tools to set you on your wellness journey? Do you want to meet and chat with expert members of the healthcare team? Well, step into real time with Dr. Stacy. Hi, I'm Dr. Stacy DeGale, your personal physiotherapist and wellness consultant who wants to make sure that you live your best life. We'll be chatting with wellness team members and inviting you as you are the center of that team. And we'll be doing all of this while you are in the comfort of your own home or office. Join me in real time with Dr. Stacy as we discuss everything health and everything wellness. So, welcome everyone, and thank you for joining us on Real Time with Dr. Stacy with your fave physiotherapist, Stacy DeGale, right here in the comfort of your own homes. And as is the norm on our show, it is an opportunity for us not only to learn and to take control of our health, but for us to realize that we have so much expertise right here in Trinidad and Tobago. Sometimes we always say, oh, we don't have this, we don't have that, we have to leave the island to go and get care elsewhere. And quite often, we have some of the very best. And to date, you all know that I only have the very best on my show. And I just want to preface this by saying all of us got up this morning, no matter what good may be happening in our lives, what bad may be happening, the good, bad, ugly, or indifferent, we were able to get up and we were able to see our surroundings. We were able to see our loved ones. We were able to see our patients, our employers, our employees. And many of us don't have the luxury of sight. And I personally, for those who know me well, know that I have had challenges with my eyesight over the last couple of years, having had 2 corneal transplants, and now have a little complication with one again. But guess what? I can see, and we take it for granted. And, you know, in commemoration of World Glaucoma Month, which was last month, I thought it necessary that we have one of our experts to chat with us for us to learn more about glaucoma, one of the main causes of blindness, right here in TNT, to learn how to detect it, how to manage it, how to prevent it, how to treat it. And I trust that those of you who are online would like and share this. Many times after the show, I get so many questions. Ask it in real time so you'll get the prompt and expert answer from our guest. So it's enough talking from me. I am so very happy and delighted that this professional said yes to me, because let me tell you, she's not only a doctor who has a passion for caring for the eyes. She is a mother, an activist, a singer, an artist, and the list goes on. So it is my greatest pleasure to welcome you. If you don't know this face, you're going to know it today. Dr. Debra Bartholomew. Dr. Deb, thank you so much for being here with us.
Oh gosh, thank you, Stacy. Thank you, Dr. Stacy DeGale. Oh my gosh, this is definitely an honor, a joy, a pleasure, a humbling experience. Thank you. I can't thank you enough.
And let me tell you all how I better, and the world is so small. So I tore my cornea. Nothing planned. Nobody plans to tear their cornea, right? And I had to go up to the doctor's office. And my usual doctor wasn't there. And I met this woman came in with this burst of energy. And let me tell you, I was depressed there. I was experiencing some high-level depression at that point because I really had no vision in the eye. And this person came and put me at ease with almost immediate effect and spoke to me as a human being, not as an object, and settled me down, explained to me what was happening, and listen, we're going to get through this, And that is why I got through it. And that was Dr. Debra Bartholomew. But more importantly, I know this is going to sound biased there, because all you know I'm from South and I'm proud for being from South. Debra Bartholomew is related to some good people in Point Fortin. Some people who go to the same church that I do, but that's a whole discussion, a whole show that we could have about that by itself. So I want to welcome you all again to Real Time. Thank you for saying yes, for being here with us. And before we, go into the brass tacks of diagnosis glaucoma, I just want to get to know a little more about you and for you to share yourself with our guests. Because I did say it in the opening that you are not only a doctor with, that love for caring for the eyes, but you are a mother, an artist. So tell us, who is Debra Bartholomew?
Gosh, I guess I'm really a multifaceted individual. Medicine is only a small aspect. I've always wanted to be a doctor. I think eyes only came about because it was the least gory of all the professions, of all the different specialties. But eyes are also the windows to the soul, and so you get to interact with professionals the professionals in the different subspecialties, but then the other aspect of me is motherhood, and that extends to me being an auntie to countless of young men and women who I try to mentor on a day-to-day basis that I may come into, especially at Queen's Royal College, where my younger son is still attending and my older son attended, and that relationship developed because my older son is autistic, so I am wearing red to support World Autism Awareness Day.
Yes.
And so I my activism started 19 almost 20 years ago when he was diagnosed, and my advocacy, I should say, and 20 years later, we have not really advanced worldwide. I'm not just saying, in Trinidad and Tobago, but worldwide, we haven't really advanced much. You have stories, you're hearing stories of people being called low functioning, and so they're not, really even worth the effort and that kind of thing. But there are people who you'd be surprised can run rings around us, So activism and advocacy has become one of my passions. Just last week in our retreat, one of our priests, he was wondering how to bring in the message of we are all welcome, and I said, let the young people from the Ladyhood Joy Home come, and so they came and they danced, and now I have some extra friends because they don't pass you anywhere, okay?
Yes.
So but I just love them, and one of our members is actually in our choir is actually Down syndrome. So our choir is quite a unique mix, right? But I love what it is. So everybody has a place, and as my son says, I don't have worth because of what I bring to the table, and that's in varying. It's not just in social justice; it's also in the workplace. It's in medicine. It's in the supermarket. It's everywhere you turn. I don't have worth because of what I look like, or how much money I have, or what I bring to the table. I have inherent worth because I'm a human being. And that's how I believe that every single person should be treated as well as a patient, So, and then my art, I use art as well for advocacy and also to educate. So that's one of the surprises that I have for you. So
I told y'all, listen, y'all gonna want me to bring her back, eh? So we already know we have a surprise in store.
This, and then this, and then my necklaces. So it's a lot. But I, you know, and if I was 10 and in this day and age, I would have been diagnosed with ADHD. You know,
Yes.
I do some. I do. It is what it is. But you know, you do what you have to do to make yourself happy. That's the most
Correct.
important thing.
And productive.
That's
And
right.
something you stated, and you know, there's a juxtaposition we can make here with what you stated regarding, you know, autism, the young lady who's living with Down syndrome in the choir, bringing in Lady Ho Choi home in the church to bring that diversity and to allow for a level of inclusion. But not just having them there as figureheads, having them there and showing their talent, showing their value,
Of course.
showing their worth. And it's important that we mention that even in the realm of glaucoma, and the possibility of persons having some degree of blindness, because many there's a level of no value if I you know, have impending loss of sight. I mean, we want to prevent it, but there's some clients, some patients, for whatever reason, may end up with a level of blindness, and you know, this should not preclude you from being a part of a society, not just a figurehead, but somebody who has some level of productivity and some value. So I think it's important to bring that even in this discussion of sight or lack of.
That's right.
And from there, you know, I think it's a great point for us to really bite down now on the topic diagnosis glaucoma. And tell us, Dr. Debra, what is glaucoma? You know, sometimes we hear these words and we're not too sure. We go on Dr. Google, and Dr. Google is the worst thing to go on to. So from a professional,
so like I said, I tell people, Google will, if you, and I say this in the Trini words, if you bust your toe, Google will kill you. Okay. but I over the years, with trying to educate patients on glaucoma, still there are patients that we are losing. Okay.
Yes.
Having worked in Tobago over the last year or two, there are quite a lot of patients who are coming in who are my age and younger, who are blind or almost blind. Okay. That is devastating, right? That is devastating. So we are missing, and we are missing a certain group of patients, and what we are missing is something in education. It's not that we're not educated enough, you know, but how do we break it down even further? What do we do? So I was trying to think of last year. I was actually our West Indian ophthalmology conference was here in Trinidad and Tobago, and I was wondering how to marry our culture, because most of the delegates, when they come, they don't get to see any part of our culture because they come in to buy. And yet there's a way to bring our culture, but yet make it health-based.
Yes.
And so I sat down and I thought how to do this. What can I use? What can I do? And so I asked a friend of mine who's an artist, Patrick Roberts, who actually is a glaucoma activist because he's blind in one eye. And I asked him, sat down with him, and I thought, how about we get a midnight robber to portray him? And he was the perfect portrayal, because he's not only menacing as a midnight robber, but a midnight robber, that's what he is.
Yes.
He's a thief, you know, and what he brings is night, you know. So glaucoma is a condition where you eventually go blind, because it's a progressive illness,
right,
unless treated. Okay, so I'm giving it to you. I'm going to give you the medical term, but I'm
Yes.
giving it to you in terms of this is me explaining it in our cultural terminology.
Yes.
Glaucoma is a midnight robber, a
Hmm.
midnight sight thieving robber. He raises the pressure in your eye, and that pressure kills the nerve in the back of the eye. He slowly strangles the nerve. So he's a criminal. So he's not only there to rob you of your sight, but he also is a murderer. He strangles the nerve at the back of your eye. And he slowly strangles him until he's gone. So that's basically it. And
So
yes, go ahead.
how does it happen? I mean, and it's so silent. It reminds me of high blood pressure. It's
Mm-hmm.
so silent until you get, well, in the most cases, until something drastic happens, you realize, wait, I'm really not seeing well.
Yeah.
It's how does it happen? What are the causes of it and the risk factors?
So there are so there is a primary open angle. There's primary glaucoma and there's secondary glaucoma. So secondary means it's caused by something, right? Whether
Yeah.
it's prolonged inflammation or something that's it's pushing. So let me explain. The eye. This is the angle in the eye where the fluid drains. Okay,
Right.
that's between my two hands, right? So things that can, and this is in secondary glaucoma, things that can pull and close
Mm-hmm.
the angle, or things that can push and close the angle. Those are
Right.
the things that would cause secondary glaucoma, right? Because there's no space for
Yes.
the fluid to drain, right? But in primary glaucoma, there is no underlying cause. The eye, it's just how the eye is, okay?
Yes.
Um, but there are risk factors. So I wrote about this I wrote a piece. This is the first time I ever wrote anything like this, right? But I also wanted to expose them to Peregrinad's speech. So I wrote
Yes.
this speech and about glaucoma and the risk factors of glaucoma.
Yes.
Um, so I said uh, go down. I bypass the first part of it because I'll come back to that. Over the years, the fight against glaucoma was like a full-on waging war. He does target certain people, like people whose family he invaded before,
Hmm. Hmm.
right? Short sight, long eye people, not macos, eh? That is something different. But I'm just telling you who else he does go for in case that's where your mind went. He does also sometimes target certain people who does suffer with head pain. I buy a whole big bag of rice and start calling it migraine.
Hmm.
But he could attack I Selassie of almost anyone: mother, father, tanty, brother, sister, and even son. The other risk factors for primary open angle glaucoma are, besides, like I said, being of short sightedness,
Mm-hmm.
people of African descent are more prone. So you find that in Tobago, there is a more aggressive type of glaucoma
Hmm.
because Tobago has a more homogeneous population.
Yes.
And
Yes.
their ancestors had an
Wow.
really aggressive type of glaucoma. So where I would see glaucoma levels of in the 30s here and be
Yes.
panicking here, right? People walking about with pressures of 50s in Tobago,
Wow.
right? Um,
Wow. Wow.
Diabetes and
Wow.
high blood
Wow.
pressure are also risk factors of glaucoma.
So I'm just saying before I go any further that Peregrinad speech piece that you did there
Mm-hmm.
needs to be circulated, and I am going to be boldfaced to say it has to be circulated on your page and then one of mine first, because just from that you gave us so much information that primary glaucoma, some of the risk factors. We talk about family history,
Mm-hmm.
the short-sightedness. I
Mm-hmm.
never even knew about the migraines.
Right.
That was something so new. We have so many people suffering from who have been diagnosed with migraines and
Yes.
their eyes are not being focused
Check.
on at all.
Yes.
So
Yes.
I'll be sending my patients
Yes.
with migraines to the ophthalmologist from now on. It affects anyone of all ages, the mommy, the daddy, the auntie, just
Mhm.
love it. And that is something so interesting with the aggressiveness in Tobago.
Yeah.
And I'm wondering now, what, if anything, is the Ministry of Health doing a little more specific for the patient population in Tobago with regards to screening of the eyes? So I think this is something that we could look at in campaigning
Yes.
and doing more advocacy work there.
Yes.
The diabetes, the hypertension, we know that NCDs, our non-communicable diseases, are so very high in Trinidad and Tobago, one of the highest in the world per
Yes.
capita, actually. And so it is important. Usually I'm a volunteer with the Diabetes Association, and the Diabetes Association and Andrew Danu, the
Mhm.
president, does really stellar work in trying to encourage
Yes.
persons living with diabetes to have regular eye checks. But I think it's most times the thrust really is on neuropathy and the damage of the nerve um, because of the diabetes. But I think we need to start calling the name of glaucoma a little more
Yes. A little
and
more.
let people be more familiar.
Yeah.
This is I listen. I told the audience before to get their pen and paper. I am making my notes because these are the things that we take for granted,
Yeah.
and not to speak too much, but when after my eye surgeries with both of the corneal transplants, my eye pressures went up so high that especially the right eye, I reached the 70s, and I had to use eye drops in the first 2 weeks after, and I had to use um, drops, so it's now about 20
Wow.
now, so much better. Um, but it's something that I have to keep monitoring as well.
Mhm. That's right.
So, yeah, I mean, this is amazing. The migraines is something that was really new to me. So, we're looking at all of these things. We're looking at so many of our population will fall into this
Yes.
category. So, how am I going to know if I have glaucoma?
And that's the thing. You don't. You don't
It's
until it's
sign
too
on the
late.
midnight
Until
robber.
it's too late. Yeah.
Yeah.
Because he's a midnight robber. He's a
So,
midnight robber.
so
Right?
what would you advise people then, especially knowing the risk factors here, and that at least every person in Trinidad and Tobago falls into at least one of these
Mm-hmm.
categories?
Mm-hmm.
How do you suggest we approach our eye health and
And
starting screening and stuff like that?
there's this fallacy of late that if I could see, if I could put my hand a good distance away from me, far enough, and just be able to see, or I could squint, I don't need
Mm,
glasses. So I don't need to go to see the optometrist.
mm-hmm,
But there is a reason for that. There's a reason for going to see the optometrist around 40, because that's usually around the time the glaucoma starts to set in. Uh,
right.
Start going and get your eyes, your pressures checked around then. You know, at least you have, and a pressure check. It doesn't take long. It doesn't
Correct.
take long to go in, get your eyes checked, and get your pressures checked. Especially if you do have a family history of glaucoma, that
Oh,
can't be stressed enough. You know, I met someone whose mother kept telling him over and over and over, and he just refused,
hmm.
and it's pretty bad. You know, um, there's something that you should know, so you should know. So what I said was, um, I said what I'm saying here today, I'm telling you is no try. P. Raise the pressure in your eye,
Hmm.
pressure to bust pipe, eye pressure that stand up hard, like big man and big woman. High
Hmm.
eye pressure is an adult, it over 21. So that's how you know what pressure
Yes,
is good and what
it's
pressure
good.
is, right?
Right.
It's not a secret, okay? Now, in the back of your eye is a nerve, an important fella. He opt to go and live there and develop a tick thereafter. This poor
Mhm.
man, the optic nerve, is he Good Friday bubbly. Glaucoma does beat him up real, real bad and strangle the life out of he. So this is where our important role of clinician and lawman comes in. because to just let glaucoma run riot and rule and win is a terrible sin. So you yourself will not know. You won't know until it's too late. I had seen, there are people who come in and shouldn't even be driving and don't
Yes.
don't know. Just their cars have scratches on the sides, and they're like, "Oh, that's why my car scratch."
Wow.
Or, the danger is you could even have a child could be walking in from the street, and you may not see that child until it's too late, because your field of vision is what becomes affected.
Affected.
Okay? Your field of vision. So I got into that part with regard to
Wow.
the field of vision. And when Mr. Robert Glaucoma beat up the optic nerve that you wield, he will damage you in a way you cannot see and destroy your visual field. You start to go bump in the night, rub the side of your car, bust your little toe, and continue to damage your eyesight until blindness is your main woe. That's why we just do visual field testing. The
Yes.
white areas will go gray and black instead. And in the old cities like Ohio and Ottawa, hills just turn to valleys and go green to red. So what that means is, if we look at the optic nerve, so look at Dr. Stacy's hair. Dr. Stacy's hair is in a ponytail. Okay, so every single strand of hair is forming a nice bun in the back of her head. Okay, that bun is the optic nerve. Okay, so that's the optic nerve, right? And every single hair, every single strand is a point on the retina. Now, when the pressure, so think of the pressure in this pipe. Think of that now as a face basin. The pressure in this pipe is damaging the optic nerve. Is now the drain pipe. Okay, the pressure in the pipe on top is punishing that drain pipe, and it's widening the drain pipe until the hairs, those hairs, and the ponytail get thinner and thinner and thinner. And so what you may at first lose your peripheral visual field, meaning that you won't even realize,
Yes.
because we use our peripheral visual field, like I said, when we're driving, especially at night, or when we go into the bathroom in the night, we use our peripheral visual field. But we might bounce our toe a little bit, and we
Yes.
might that's just from that, or and we don't realize how much it's encroaching and encroaching and encroaching until our central visual field is gone. Some
There's
people,
sorry, Deborah, but something came to me. There's a part of physio that is becoming increasingly popular in neurophysio. I'm saying that because so many things are popping into my head and so many patients I'm red flagging in my head now, where we're starting to do more work on screening of visual fields. Because we are recognizing the connection of the eye to brain to movement. And there is a big connection in persons, especially persons who have vestibular problems, balance issues. And so a lot of us neurophysios, even for orthopedic cases, so even though you might have back pain, but it's chronic, it's not going, we start doing work with your visual field, screening your visual field, and start doing work on gazing. And you'll be amazed. Sometimes the pain goes by 50% in a short space of time. And what you're talking about, the hitting of the little toe, our patients say, but Mr. Gale, I don't know why I bounced my toe. Why am not? And I have some older patients, and you're seeing the scratches on the car, and they're like, where are these scratches coming from? So now we have to really look at our patients. For me as a clinician, look at patients more holistically and sending them to other experts, especially as you noted, start doing your screenings from about 40. And again, you're not going to know until it's too late. So we have to do the screening. We have to do the visual field, the testing. This is vital information that I hope my audience is listening to. And just to let you know that after this is on YouTube. I post it over. A lot of people look at it. So far, I have hundreds of people looking at the videos for almost 3/4 of each video. So I'm excited that this information is
Great.
going out. Yeah, for the man on the
It's
street as well
interesting. It's
as
interesting
the
that you said that, because I actually had a couple of patients who had falling incidents,
yeah.
and it's because, and I almost can predict. So when they say that they've been falling, I can almost predict what part of the optic nerve is damaged. So
Wow.
so the optic nerve corresponds to the visual field. It flips. So the
Right.
upper part of the optic nerve corresponds to the lower visual field, and the inner part of the optic nerve corresponds to the outer part of the visual field, and vice versa. So the
Right.
part of the optic nerve that you really don't want damaged is that upper part, because that
Mm,
means that their inferior field goes, and they cannot
right.
see to walk. Remember, we don't
Right.
depend on the superior visual field, but we depend on the lower visual field.
Right.
And so there are a few patients who had started falling, and I actually made recommendations to to physio. One was up this side, so I made
Yes.
recommendations to physio and to OT, because I told them they
Wow.
now needed to see how the home is and focus on
Yes.
the home, because too many falls were taking place. Too many falls were taking place in home, and it literally was because of the glaucoma. Interesting. It's
This
interesting you
is
mentioned. It's
amazing.
all connected. It's all connected.
Correct. But I have to give you kudos. We didn't come here for that, but I don't let it go unnoticed. For you as a medical person, as a doctor in particular, to recognize the value of the other professions. Many of our medical fraternity don't until it's too late. You wait until something is really, really bad and you pick up on it and you send to whom could make a difference. And thank you for that coming from an allied, a
Okay.
allied health professional. Because we each have our role, and if we have a
We
holistic
each have
approach to
our
our
role.
patients, they will do so well. They'll do
That's
much
right.
better.
That's right. That's right. And it's
But
it's it's it's
mhm,
about it's about providing the a good quality of life for every
yes,
single patient,
that's correct.
because people don't have to suffer. I don't think most of us who are, have all our faculties and whatever, if we were to lose just a touch,
Hmm,
we wouldn't begin to understand
that's
what
correct.
patients go through. So it's
So
it's
so
in
true.
making sure that every single person again is treated as a human being, and
Human
and
being.
has a right at the right, or as good a quality of life as
Yes,
they can.
yes, so true. Now, patient S comes in. You've done the visual field testing. We've tested the eye pressures. Pressure is over 50 something, and we seeing that there's a loss of the inferior field. What are the next steps?
Okay, so I sit down with this patient and I say, okay, so there's some things that I need to discuss with you. Um, Remember that I did mention to you that there is a possibility that you may have a certain condition because the pressure's been high. Now, if a patient has a pressure of 50 something, they don't leave my office. As a matter of
Mm,
fact, if the pressure, if they are uh, um, if they're diabetic, the pressure of 25 and above must be treated. If you see changes in the nerve, you treat, and 28, 30 and above, you treat. Okay, because there are other risks other
right.
conditions can happen. That pressure can actually squeeze a vein at the back of the nerve, so it's actually pretty dangerous. But I would say sit down and I say to the patient. So I allude to a possibility when I see them the first time, so that I don't spring the diagnosis on them when
Yes.
they come back. And I said, that we were discussing that there is a possibility that you may have this condition called glaucoma. But remember that I also told you that having this condition means that you're going to be on jobs for the rest of your life. But that
Yes.
doesn't mean that 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 is the end of life for you. It doesn't mean that you will go blind. We do need to be on
Good.
treatment, and some people need to be on high blood pressure treatment. Some people need to be on on diabetes treatment, asthma treatment, the different
Yes.
treatments that they need to be on. And this one is yours. You have to be on glaucoma treatment, and you have to be regularly followed up. So the follow-up entails us doing scans, it entails us doing field tests. But once we make sure that we are on top of this and we get the pressures under control,
Yes.
then we can stabilize this condition and either halt or slow down the progression of the disease. And if we can't slow down, then we discuss what other steps that we can put in place. Also bear in mind that we start off with one drop and we can go on to other drops. If it's somebody who's young, I usually recommend laser. Somebody older, they tend not to like the laser, so they tend to prefer, they take the drops and they're okay. And usually they
No.
do with, and yeah, and for the most part, they said it takes a little while. Some people it takes some time. The younger person, it takes some time to digest that I actually really have
Correct.
glaucoma. But I tell them I'm here for you. If you need to have a conversation with me, this is my number. You can call me, or this is the number for the clinic. You can call them. They can put you on to me. But
Yes.
I am here to have a conversation with you, to be there for you. This is not something that you're going through alone.
So this is of course a life-changing diagnosis. And again, I must say kudos to you for your initial step is okay. This is not okay. We have to do this. We have to do that. No, your initial step was to show compassion and to educate the patient. And as we know in health, for patients to stay on a treatment, the patient education is so vital. And then giving them options. So you mentioned the use of eye drops. You mentioned laser. So this is a two-part question now. Can you give us an idea of when you speak about laser? Often people think of laser as just being, oh, I could do laser and I don't have to wear glasses anymore. What does the
Yes.
laser do for patients with glaucoma? As well as, are there any innovative treatments on the horizon for patients living
Right.
with
So I'm
glaucoma?
glad you asked that, because that's actually in my poem.
Ooh,
Um, so because and I guess because with regard to glaucoma surgery was an very invasive surgery,
right.
and wasn't always successful, especially in our population, because we tend to scar. Okay, remember the eye heals after you cut.
Yes.
After you get a cut, the natural thing is to heal, and
Yes.
it's going to heal. You're trying to create a flap, right, for fluid to drain out, and the
Yes.
natural thing would be for that flap to heal, scar down. Okay, so newer micro, what we call micro invasive, meaning that you literally just insert a tiny little a valve or a shunt into the eye to help the fluid to drain better in that space, that is there, in the angle. Those were things that have been devised.
Right.
There's a laser that we used to do, and but that laser didn't do well, and so they took it, not took it apart, but they went back to the drawing board,
Right.
uh, and worked out how to do this laser, um, to make it more effective, and cause less trauma to the eye.
Right.
And it's called selective laser trabeculoplasty. So the trabecular meshwork is where the fluid drains, and plasty is to reshape.
Right.
So trabeculoplasty means it's reshaping that area. So selective trabeculoplasty means that it's selectively reshaping that area, right? And it's actually done so well that it's offered as first line, um,
Mm.
in many countries, in the States, and in young people, and a lot of young people, it's offered as first line. But like I said, in older folks, they tend to prefer. They would ask you, "Is there anything else?" They tend to
Uh,
ask you, you know. So this is where I actually mentioned this in the so since the first of the treatments was discovered in 1856, more and more strides have been made to prevent Sir Optic from taking licks. Maltino, which is a valve, was the first one of its kind, followed by many others. With shunts and tubes and valves, they use that to make aqueous detours. So aqueous is the fluid, okay?
Yes.
Um, so we patrol with drops during the day and drops when you're sleeping in the night. Sometimes we just have to take the charge to him and really amp up the fight. Now, this poem that I wrote as I am a clinician and a lawman. So
Yes.
Midnight Rubber is he feels a bad man, and I am the lawman, right? um, Sometimes we have to take the charge to him and really amp up the fight. Ecto, which means to cut. So we did a trabeculectomy, which is to cut out a piece, or trabeculotomy, which is to make a hole. Take out a piece, make a hole, used to be the main surgery, but that's not always effective. And sometimes the EYE could end up just E. We used to cyclo destroy with a laser. Cyclo means to go all the way around with a laser. Right. Blow him up, lay waste to the land. But these days, we micro-invading. To do the job is only one man or one woman. We're sending in agents who fight for the cause. None of them is a vagabond. We send in, and these are the names of the new shunts, the new micro shunts that we use. We send in iStent, Cypass, Zen, and Hydrus, the way MI6 does send in James Bond. And an agent, a woman called Trabeculo, who got married to a man named Plasty. We debrief, reprogram, and retrained her, and then sent her in selectively.
Yes.
Right?
That's a selective trabeculoplasty.
That's right. That's right.
But it's it's so ironic that the first surgery said was in 1856. And here we are still battling with it. But thankfully, we've seen improvements in the techniques being used and how the outcomes are much better. So somebody just messaged me on one of these streaming pages asking if any of these newer types of surgeries are done here in Trinidad.
Yes, they are. There are surgeons who are doing them. It's just that we actually have companies bringing in the different the stents and that kind of thing. Mm-hmm. However, again, the key is early intervention, early diagnosis.
Yes,
that's the part that we forget.
Forgetting. Yes,
we think that if I have a pressure of 60, using one of those tubes is not going to work.
Yeah.
It's not. So early and you see when you have a pressure of 60 and you have a nerve that's 90% damaged, you don't have much time.
Correct.
You don't have much time at all. So, and that's why I keep harping on education. And educating in a way that we get it. Because when I explained, my dad has had glaucoma for years. And it was only when I have explained to him several times. And when I read this poem to him, he said, "Oh, I understand all the different things." And I smiled because I would have explained all of that to him before.
Yes.
But this is the language that we speak.
Yes.
This is what we speak.
And we have to speak in language for patients to understand. Sometimes we forget, and sometimes patients come to me and say, "The doctor didn't tell you about that." Well, he used this word and she used that word and I didn't understand, so I have to get to brass tacks. Because even as a clinician, if I go to a medical person with an issue, you need to talk to me so I can understand.
That's right. Exactly.
And with any condition, and I want to really emphasize this to the viewing audience and those who are going to look at this after. Education is key.
Yes.
Early detection is key. The only way that will happen is if all of us become participants, active participants in our healthcare, so that we're not waiting for something to happen, that we are proactive, that we are getting younger. We must do our checks for our eyes at least yearly. People like me, we have to do it more often, but at least yearly to detect certain things as quickly as possible. If you are living with an NCD such as diabetes, to make the lifestyle changes necessary to minimize the negative effects of having the diabetes, the hypertension, of preventing your cancers, etc. And the thing is, we're seeing the same thing goes for our eyes. Somebody just asked a very interesting question that I actually have here written to ask, because sleep is a big thing now. We are seeing the direct connection of lack of sleep and the increasing numbers of persons living with diabetes. And we're seeing that if persons utilize their proper diets, exercise, take medications as normal, and get appropriate sleep, they're actually able to manage diabetes better. So somebody's asking, can lack of sleep worsen glaucoma?
Yes, it can. As a matter of fact, lack of sleep. So if I have a patient who has been under control, I tend to ask them, if they come in with their pressures a little bit elevated, I ask them if they slept the night before. And that was actually something that Dr. Deo Singh, who's
Yes.
an ophthalmologist for how much ever years, and well, I mean, Dr. Singh,
Yes.
and that was something that Dr. Singh taught me, and I hold on to that because I've seen it, where you don't sleep and the pressures go up. So I also have patients who, some time of the year, they sleep less because of the job that they do. And so what I would have to do is I would actually have to protect them and put them on an extra drop to make sure that the pressure stays in limits, because the pressure will stay elevated.
So as you mentioned, the drops again, how do the drops work? I understand, I could see what happens with the surgical part of it, you're creating this drain, for example, but how do the drops actually work to reduce your eye pressures?
Yeah, so I ask people to look, if they remember Tom and Jerry.
Right? I remember Tom and Jerry.
when Jerry's holding the hose, and there's a big buildup, right? So how the drops work is they either make Tom turn off the pipe, or they make Jerry let go the hose. That's basically it.
I like it. Yeah, right? So one or the other.
Yeah. But so think of Tom and Jerry, and then So glaucoma basically is Jerry misbehaving.
Yes.
Jerry misbehaving, and So one set of drops. There's some drops that also work two ways and create two outflow paths.
Right.
But most of the drops, that's the way they work. And so the lasers and surgery would work that way to help fluid to drain better.
Well, Dr. Deb, our culture is big on the herbs or what we could do naturally. So I'm going to ask this question. I'm going to audience, listen carefully. Sometimes we get the proper answers we don't like. With regards to glaucoma specifically, are there any foods or nutrients that would help to reduce the eye pressures? And with that said, generally, what would you suggest from a food and nutrient perspective that could help overall with our visual acuity?
With regard to visual acuity, we know that vitamin E, right? Because that helps with your night vision, right? So we know about that.
Yes.
And people who have issues with macular degeneration, we know
Right.
that lutein and selenium and those, and they're actually vitamins for that. And a healthy,
Yes.
natural, healthy diet also helps. But with regard to glaucoma, there isn't really much.
Mm-hmm.
Making sure that your blood pressure is under control is key.
Yes.
Because there are a number of things that can also happen. So, for instance, I'll explain this. Think of think of you have two people sharing this very tiny space, okay?
Yes.
And one is extra much. One is pumping iron constantly, okay?
Right.
Um, and has no choice but to pump iron, okay? Because just pumping iron. So the one that's well weak and waffly starts to get squashed and squashed and squashed until eventually he can't function anymore.
Yes.
Okay, that's what happens where arteries cross veins in the back of the eye.
Mm-hmm.
In the back
Mm-hmm.
of the eye. Okay, the arteries pump iron when your blood pressure is high.
Yes.
So they get more muscular when the blood pressure is high, and they squash the veins. And then on top of that, you
Mm.
now have high pressure in the eye that can further do the damage. And that's
Yes.
why we tend not to allow patients with pressures above, if you're hypertensive, if your pressure is above 25, that pressure needs to be treated, even
Yes.
if you have glaucoma or not. Okay? So making sure that you eat healthily, cut back on
Mm-hmm.
certain things, you exercise, all those things help. Sleep, all those things help. It helps to be healthy, right? Somebody said to me, you know what I heard? Orange juice. And I said, no.
You said like how I would say to my patients, no.
I said, just like that. It's like, no, okay? No.
Yeah.
Yeah, it
And
doesn't work.
we always hear, and Sandra said that work for her. Sandra doesn't have the same problem that you have. Or
I
even
actually
if
had,
we have
I
the
actually,
same thing, it may
no,
present differently.
that's right. That's right. Exactly. But I had someone who told me that he was taking local eye drops. And I was like, what do you mean? And he said, local, made here. And I said, but there are no local drops made here. And I'm going to be very, very particular about this. Drops
Yes.
have to be FDA approved,
Yes.
because remember that drops, you have a certain shelf life. They have to be healthy. They have to
Yeah.
be free from bacteria, and free from
Okay.
microbes. So you have to be really careful what you're putting in your eye. You can put something in your eye that can ruin your eye.
Oh
Yeah.
yes.
So you have to be really, really careful of what, and so people who are telling you that they have local eye drops, please be careful.
Yes.
And this person's pressure was in the 40s, and because he wasn't going to clinic, he had no idea that
Mm-hmm.
his pressure was high, because again, there are no real symptoms of primary open angle glaucoma.
Yes.
Okay, so here it was, his pressures were in the foot, it was almost 50 actually, and he's using, and this is his friend,
Mm. Yeah.
this
Give
is
it
his
this thing.
friend who gave him these drops. And I told him, I said, this man could have put urine in a bottle. Another thing that they swear by. He could have put urine in a bottle
Yes.
for you to use. By the way, that's also not so, and so be really, really careful, because you can lose your eyesight for just the simplest silly things.
Yes.
Use the drops. Yes, drops have side effects. We need to make sure that you aren't getting any, or you don't have anything that precludes you from using certain
Correct.
drops. For instance, my dad, his regular pulse, because my dad sails, so his regular pulse
Right.
is 60, 59, 60. So there's certain drops that he cannot take, um, because his pulse will drop to 42, 44. That's unhealthy.
Wow.
So we know he can't take those. So, and that's that. So he's on whatever,
Yeah.
and he's happy now. He's happy. His eye pressures are fantastic, and he's good,
Yes.
right? But you have to, every not the everybody's eyes are different.
Yes.
And one eye might even be different to the next.
To the next.
So be really careful. Make sure that you're seen by a health provider
That's
only
right.
where glaucoma is concerned. I cannot stress that enough.
Correct. Not Tanti Gloria from Never Weary. All
Yeah.
right, and it's all because you want to ensure that you're treating the eyes properly, that you're not worsening any issue, and you're doing what is right by you. Remember, you mentioned something, and it just had a light bulb moment. A lot of patients say, "Listen, I'm not going to hospital and clinic now. I don't wait too long." I said, "So when last you went to the clinic?" Me I go any long this time. I go, they just puff this thing in my eye, and then and that's it, and send me home. No, that is how they're going to have an idea of what's happening with the
That's
pressure
right.
in the eye.
That's right. That's right.
Have your
Exactly.
eyes checked.
Checked. Yeah, and it
We
doesn't
are
take long. It really doesn't take long. And
It
most
doesn't.
places you can go and get your pressure checked. If you go to some ophthalmologists will even have it free,
Yes.
depending on, if you're a patient, that is. But
Yes.
yeah, it really doesn't take long to just get your pressure checked.
That's your pressure check, and that could save your sight.
That's right.
So, Deborah, it's coming up to about an hour. I tell you, the time goes really quickly. And
It
I
does.
want you to share a success story with us that you could recall, something of a patient with glaucoma whom, your dad to me sounds like a success story.
That is.
Yeah.
You know, uh, but that's a success story. He also had cataracts and so had his cataracts removed, and that is walking about and doing all
Right.
the, and driving and sailing and you name it. I mean, and this is somebody who actually had to stop driving at night.
Right.
And he stopped driving at night because the combination of the glaucoma and the cataracts were really starting to create a problem.
Right.
And having cataract, now he's not had glaucoma surgery, he had cataract surgery,
Right.
which also helps in many instances to drop the pressure.
Yes.
And he's on his glaucoma medication, and he's seen regularly, comes and gets his pressures checked, does his field test ever so often, and his scans, and he goes his way. He's
So when
very
you say
happy.
regularly, that also triggers how often, ideally, should someone who has been diagnosed with glaucoma, I know there'll be variances depending on severity, but on average, how often should they see the
So it
ophthalmologist?
depends. If in the first instance, I see, depending on the pressure. So if the pressure is very high, I would see them back in um, by a week,
Yes.
right? To get the pressure checked, right? I would check the pressure in a half an hour. So I give them something, check the pressure in half an hour, and then check them back in a week to 2 weeks, depending on
Yes.
how high the pressure is. Then I would see them a month after to do their to see the visual fields and the scans.
Yes.
And after that, 3 months after that, to make sure that we're still under control.
Yes.
I can actually choose to repeat, depending on what the control is. I can choose to repeat the scans, and or the visual fields at 4 months, because
Yes.
that tells me what the control is like. And
Yes.
then if they're well controlled, 6 months, 9 months, a year, right?
Yes.
Depending on how stable, right?
And
But
that's very interesting to me,
normally
akin
most
to
people are six
persons
months.
living with diabetes, for example. You might have an off day today, but
Mm-hmm.
you do your A1C, or my people living
Mm-hmm.
with diabetes, you do your
Mm-hmm.
A1C every 3 months to get an idea
Mm-hmm.
of the
That's
control.
right. That's right.
Yeah, so that's amazing that even with
Yeah,
the eyes,
yeah,
there's something similar.
exactly. It
Oh
is.
my God, Deborah, I'm learning so much.
Yeah. So you but I had someone who'd come in, and he'd actually been, so it's also an issue where we have to do better with regard to our system,
Yeah,
you know, where glaucoma patients can't wait.
yeah,
Our system, glaucoma patients have to be seen earlier,
yes,
right?
Agreed.
They have to be seen within a certain time period in the public service.
Yes.
Anyway, so when I went over to Tobago, so I saw him, and his pressure was almost 40. And I was told, I was you have to, we don't have, because we were trying to that clinic was a clinic for screening for patients with cataracts and that kind of thing.
Right.
So getting in medication and that kind of thing was, and so we managed to get in, and the clinic in itself is a success story. And we managed to get in stuff for that patient, and
Yes.
I didn't even recognize him when he came. Um, I actually didn't recognize him when he came. He just walked in, and he was sitting down there, and he waved at me. And I just waved back, and then
Back.
I said, "Oh my goodness." And then when we checked his pressure was in the teens. And I was
Right.
so happy. I was so happy. You know, and he would pass by ever so often. And even the gentleman who was taking his friend's uh, medication, his friend's he comes by ever so often, because I told them,
Yes.
come by. It's not going to take long for me to just check the pressure, although it does take a while, but because it's just me. But I said,
Yes.
come by and I'll check it, and even he's come by, and his have been, his was almost 50, and his has been mid-teen since. So
That's fantastic.
I'm really, really happy, because we don't look at the devastating effect that it can cause.
Yes.
Because blindness it's a new life. It's a new, and if you ask 100 people if they'd rather lose a limb or they'd rather be blind,
Yes.
I
The
think
rather
maybe,
lose a limb.
yeah,
Yeah.
99% would say they'd rather lose their limb.
Um, Dr. Deb, I have a few patients asking, so I have to put up one. This is just one of the persons asking. Thanks, Steffi, for being online and staying with us. And you're not the only person asking, where is this doctor located? If someone wants to get screened and to get more information. Can you share with us, Deb?
Yes,
And
I am at
any
Caribbean Eye Institute in Valsayn on a Friday, and I'm also in Arima. So you can call Caribbean Eye Institute. The numbers are 662-1226 and 667-2802.
I forgot I know those numbers by heart. I'm writing
Yeah,
them down. As well.
right.
You know these numbers by heart, right?
Yes. Yeah. So
And where
I
are you? And in Arima, you have a another.
667-2802.
And I'm thinking for my Southeast, we have many eye places in South Trinidad, not advertising any at this point. However, I'm thinking that, Deb, and we'll talk about this at some time, to maybe do some added screenings in Deep South. I think that quite often we forget the very Deep South, and that includes Ikaka, Cedros, Point Fortin,
Good idea.
Bonajeris,
Good idea.
And especially in the age group, a lot of these persons, the 40 and over age group, how they work and where they work, a lot of them,
Right.
the hours, they find it difficult. And we have to be fair and understand that life is lifing. And so people are seeing, listen, if I don't work today, I'm not going to get paid. How am I going to see about my family just to come up to
So we
something for 10
so we
minutes?
definitely have to work out something.
Yeah.
Yeah.
So guys, those who are online, if you have a screen and you see this as something as important, for example, in your church, in your social groups, reach out to me, and I will reach out to others, including doctors like Dr. Bartholomew here, who have an innate desire to improve our sight. Just reach out and we can see what we can do and create a movement, create an eye health movement in Trinidad and Tobago. And what I want to tell all of you, if there is a need, we need to say what the need is. Sometimes change in our health systems occur by you, the patient or the client who
Yes.
is in need of something, by raising your voice.
Voice. That's
So we
right.
encourage you to do so in a respectful manner, no matter what color you may be waving for the silly season coming up, but it is for all our health. So I want to start closing off a little bit on this area, and I want to open back the floor to Dr. Bartholomew again to remind us about this midnight rubber of our site, to remind us of what we need to look for, and to underscore that there is hope once we follow the instructions about early detection and prevention. So, Dr. Deb, I am letting you have the almost last word.
So remember, you may not have any symptoms, okay? It's important once you're over 40 to get your eyes checked. You're getting your eyes checked mostly for your pressure, and then they're going to take a look at the back of your eyes if they can. That's by the optometrist. But if you wish, you can make an appointment to see an ophthalmologist, okay? But it's really important once you're over 40 to have your eye pressures checked and have yourself looked at, examined, screened for glaucoma. It's way too high in our population, okay?
That's right.
So remember, me and the rest of my clique. Remember, we are the lawmakers. We're here to stay, right? So we issue a threat to glaucoma. So we are on your side. So glaucoma, your reign might be over. We lawmakers, we're here to stay. We know the fight is easy, but we go fight to win the day. You feel the eye is your domain and that you is the real Bajan, but we can mash you up with the treatments, and don't forget education. I ain't giving you no more warning. I will give you a stern lesson. We clinicians out here will bust your head again, but within your crease. Talk done.
Talk done. Talk done. We coming out like Bajan for this disease, for this thing.
So I have something for your viewers to choose, actually.
Get ready, people.
So
I didn't know this was happening. She has a surprise.
So this is one. Now this one shows you that is,
oh my god,
piece of the visual field is actually missing. So this is what can happen, right? So this is one. Okay,
that is beautiful.
And
this is done by Debra herself, guys. Remember, I told you she's also an artist. Wow.
And this one,
so
I'm not sure if you can see this one just now.
I'm not sure if I'm seeing it. Yeah.
Stop my
the background. Yeah.
Background. You'll see all my children close behind me, but that's all right.
That's all right.
Yes.
Wow.
Right. So this is that's
Mr.
Midnight Rubber. But you can see that even so, see part of the visual field, but you can see even so there's still light. There's still light, as Patrick Robert said to me, there's still light in the darkness.
That's right.
He told me that, right? There's still light in the darkness. And the last one is despair and hope. And I named this one despair and hope because sometimes we feel that in darkness there's just light on short of light, but there's no color, there's no joy, there's So
beautiful.
So out of those three, which one I'm going to blow back my arm thing, sorry, yeah? Out of those three, which one do you guys think that I should give to Stacy.
Oh, I am getting a gift. Oh my God. They're so beautiful.
This is a
Debra,
surprise.
thank you so much.
She did not know that this was going to happen.
And they're all gorgeous, guys. Those who are online still. Papa line, which you all prefer?
1, 2, and 3.
1, 2, or 3? No, don't get shy. Usually I don't have shy viewers. Or else I'm just going to have to pick myself.
Yes, otherwise she'll pick.
But it's amazing, as people deciding which one. I'm not expecting that. Let me see, I see somebody is commenting. Somebody said the first one. Thank you, Miss Gibbs. Somebody said the first one. It's amazing how you use Shavana. Hi, Shavana. So Shavana and Balmati Gibbs are two persons who always come onto my shows and comment and look and share. So thank you all so much. So Shavana says the last portrait. Ms. Gibbs says the first one. Do we have any tiebreakers looking still? But while people are deciding, Debra, it's amazing how you use your art to educate, to share, because just that you showed, how somebody with glaucoma will see how their visual field is going. It's not just about painting for the sake of painting or drawing. You do it with a purpose, and that's just amazing to me. So thank you so much.
When I did this exhibition with Patrick Roberts for World Glaucoma Week,
right.
And last year his exhibition was about windows, and
right.
Finally seeing through the window and seeing what you can see, and I for me now doing this is second year. So his second one, this one was I can see the trees,
right.
And it was also full of life.
Yes.
And my pieces compared to his, you can tell that I am seeing everything from the clinician standpoint.
Yes.
He's the one who's blind in one eye.
You understand? The irony.
You understand the irony that I am seeing gloom, almost doom and gloom. Not doom and gloom, but I am, because I'm not there to convey doom and gloom. I'm there to give hope. But yet still, I am the one who's seeing, glaucoma coming in and what it can cause, and yet he's the one seeing. I mean, you should see the pieces for I Can See the Trees, the on the beach, and the way the sky has the pink, and it's so. And I thought, you know what? Next year, I am actually going to paint from a life perspective.
Yes.
Not from the perspective of a clinician.
And I guess that's a lesson for us, especially it's a lesson for us, especially Debra, as both of us are Catholic, and for those who may know, this is a Jubilee year in the Catholic Church, and the theme for this year is all surrounding hope, and we are pilgrims of hope. So as clinicians, as patients, as caregivers, no matter what diagnosis, whether it's glaucoma, diabetes, cancer, we must be light bearers. We must be pilgrims of hope. Because as scripture says, for those who read the scripture, whether they believe it or not, but the reality is that hope does not disappoint.
Yeah.
And that's the lesson here for us.
Yeah.
Debs, nobody else is commenting. They're on, but they're not commenting. So we leave it to you. But
I'll let you decide. I'll let you decide.
But there's something about the Midnight Rubber that kind of spoke to me.
I'll definitely put some more white and glitter on him.
Thank you so much.
You're so welcome.
Dr. Bartholomew, it has been a great pleasure. And one or two people messaged me and says, okay, she has to come back to speak about autism and other things. So I'll put you down. We just have to get a date.
Yes.
But thank you so much for bringing your expertise, and more than that, for bringing yourself into this, and for using the Trini parlance and our, you know, figures in our mythology as Caribbean people, as Trinis,
Mhm.
to explain glaucoma and to bring it to a real tangible place for us to understand. So thank you so very much for that. Again, remember I said she's a doctor, mother, artist. We've seen so much of her artistry with her paintings. Her necklace, you may have seen it a lot if you look on the newspapers, actually. Some of her pieces have been featured on the necks of prominent women in Trinidad and Tobago. So if you want to get in contact with her, let me know to get one of her necklaces and pieces. But for the purpose of this show, we're talking about glaucoma, and we have let me put it back up for those who are interested in contacting Dr. Bartholomew. So you can contact the Caribbean Eye Institute at 662-1226 or 667-2802. Or if you want to direct message her, direct message me, so I'll screen so you're not harassing her. Just harassing for so. So Doc, just stay on the line. Don't go anywhere. Let me just have one quick word with my viewers. So guys, thank you so very much for all of you for holding on, even though we had some small technical difficulties in the beginning. I hope that you get an opportunity to go through this video again. It will be there on my YouTube channel. It will be there on my Facebook pages for you to peruse and to share with your neighbors, your family and friends, because again, glaucoma is the midnight robber of our sight. And the only way we're going to know before it's too late is by screening and early prevention. And of course, making sure that we adopt healthy lifestyles. Can you imagine that even what we eat, how we exercise impacts on our eye health? So don't take it for granted. It's not only about looking good for the carnival costume. It is also about getting control of almost every disease that is plaguing us today. So guys, stay tuned. I'm going to have another special guest in a couple of weeks. Not going to tell you yet. As soon as I'll just send it out so that we can take control of our health, that you will get an opportunity to ask the questions that you may not be able to ask even at the doctor's office. And as I always say to you, love to all and stay well. See you very soon. And thank you again for joining Real Time with Dr. Stacy. Bye, guys.